Good morning, Ellie. How are you?
I'm good, Kasha. How are you?
Very good. Thank you so much for agreeing to talk to me this beautiful morning.
Oh, it's good to be here.
Thank you. Ellie, I will start with introducing you.
Sure.
I work with Ellie for 6 years now, and she is an advanced practice nurse in psychiatry with very broad and long clinical experience right now. And my understanding is that you've been with the Roger Williams system for about 3, 4 decades now. Can you tell me a little bit about it?
Yeah, I've been there for 32 years, working as an advanced practice psych nurse, doing both outpatient private practice in psychopharmacology and psychotherapy, as well as running the inpatient psychiatric consult liaison service for the medical hospital. So it's been exciting, and part of my job is also as a clinical instructor with medical students when they do their psychiatric rotation for their third year. So it's a very diverse job and challenging on a daily basis.
Yeah, that sounds like it would be challenging, and it definitely sounds like you have your plate full.
Uh, Most days, yes. But it's
Good.
good.
Good. And, obviously, thank you for service for patients. Behavioral health and psychology, psychiatry in general, that there's a lot of unmet needs. And this is as you know, in our community also, we could use any help we can get in this department. And we share a few patients, and we talk sometimes about patients without any specific. For 6 years, obviously, we had some contact, but I'd like to change gears and talk a little bit specifically about pandemic.
Okay. It's been a challenging 3 or 4 months.
It has been very difficult.
Yeah.
And what surprised you most about your discipline with pandemic as far as the patients and providers?
It's not so much surprised, but I think that with the advent of using more tele sessions, it's been an interesting experience with my outpatient practice because I believe in tele sessions if you also have video as a part of it. If you only have audio, it really, for the already established therapeutic relationships, it has sort of a negative effect on them. I think there's something about that person-to-person contact that aids in the therapeutic alliance. So that, I guess that was a bit of a surprise to me. That certainly it has given us, the telesessions have given access to people
Yes.
who have not been able to get out of their homes. My practice is a little unusual for a psychiatric practice because the vast majority of people I see in my outpatient office are people with very complicated medical comorbidities.
Okay.
So for them, it's been even more stressful during this
Yeah.
pandemic about the need to stay inside and to
Mhm.
not expose themselves. People you've referred to me from your rheumatology practice. I also see
Mhm.
many, many, many oncology people. So, so that's been a positive about the ability to stay in touch with them through teleconferencing. Anxiety has certainly been a major issue, even with people who have never experienced anxiety before. The
Yes.
whole not knowing the complexity of change in lifestyle, so many people having been laid off and financially
Yes.
uncertain about the present and the future has created, I think, and enhanced a whole component of anxiety that a lot of people have been surprised about. So that's been a big issue during the pandemic. So
I think you touched on two important issues. That, first of all, that telehealth, or telemedicine as we call it, really helped us very swiftly to transition, especially on outpatients, to this visit with continuity of health. Because, as you know, I see also a lot of chronic patients which require continuity of follow-up,
really,
but that also creates challenges. And I think that another thing we can't miss is that we are learning on a go, and as you pointed, this video visits are much more substantial, or help much more if you can see, in your field, it will be probably facial emotions, and expressions, which if you don't see that, I have very hard time to read people's voices on the phone.
Well, the interesting thing is, and not to get overly clinical or academic, but there's been multiple studies, long-standing, established understanding that 66% of human communication is nonverbal. So when you lose 66% of your contact with a person, and you're trying to be therapeutic, whether it's rheumatologically or cardiology or oncology or psychiatry, it's a huge piece of the person that you lose if all you have is their voice.
Absolutely.
Even though we are capable as human beings of expressing emotion with our voice,
right.
I think the old adage that I feel terrible and then I get to my doctor's office and suddenly I'm fine, that's also gets demonstrated on the phone.
Yeah, definitely. For these few minutes that they have you on the phone. And another thing that comes to my mind is, what do you think is a long-term effect of a pandemic on the mental health field, in a sense of what do you see mostly changing in the diagnosis in psychiatry illness? Is it going to be something mostly anxiety related, that patients are going to be more fearful, or what do you see in that?
I do think that anxiety is a major issue that has demonstrated itself to be a much bigger piece of the picture overall.
Mm-hmm.
And I think as we move forward, life is going to be different. I do believe that this pandemic is going to have long-lasting effects on society and how we live our lives and how we interact interpersonally. I think the fact that technology was so established before the pandemic, it's been a gift in many ways. But the fear I have from a professional perspective is that it will become routine, that technology will take over the field and we'll lose that essence of the important relationship in the therapeutic alliance. But as we do move forward, I think that anxiety is probably the major component of mental health that has been affected. As you know, mental health issues and diagnostic criteria for mental health illnesses have basis in medicine and in science. So people need to meet criteria for the diagnosis. Anxiety is a normal human component that we all have anxiety. And anxiety is an important part of life. It helps us to do things. Mm-hmm. When anxiety takes over our life, then it becomes pathological. And
absolutely.
So we need a little bit of anxiety.
Yes.
Find every person needs to find that balance of what's enough anxiety to really help us in our lives and what's too much so that we become paralyzed. And once an anxiety paralyzes a person, then there needs to be truly medical intervention. And there are certainly methods and medications and techniques, complementary therapy techniques as well. Medication's not always the answer. So there's so many other things that people can do between physical exercise and yoga, and many of the different complementary therapies are applicable in helping people manage their anxiety. So,
I am so glad you mentioned integrative, alternative, or complementary. There's so many different names because, as you know, I am very interested in that field, and it's really my passion to incorporate it in rheumatology field. And many patients with our diseases, deal with a chronic pain and chronic change of quality of life. So we have to also recognize the mental health component. But I'm going to ask you, how do you think, oh, there's a fly. How do you feel it's going?
The real world.
I think Ellie, it needs analysis.
How does
that consultation start?
Would you ask your question again? How do I feel?
Yes, I'm going there. The fly just interrupted me. So I'm thinking, how do you think it's going to change the medical personnel? Because I think that often we are trained and portrayed to you do one thing and you go to the another, but there's so many changes, the way we practice, the way, there's this limited allowance for touch. And, patients come with gloves and I ask them, the first thing I ask them, can I even touch you? And I had a patient who told me, could you please not touch me? It was at the very beginning of the pandemic,
Sure.
but there was definitely, the fear in the eyes, and I complied.
Well, I do agree with that. I think that, again, I actually had a woman who called this week. I'm starting to integrate back into my office. I continued through the pandemic of seeing people face to face in my office, people who were comfortable, people who were not autoimmune and compromised, who felt that they really wanted to come into the office. I have a physical setup with my outpatient office so that I was able to help that happen. But I've done many teleconference sessions. Some of those teleconferences I'm bringing back into the office. And one woman who, she herself does have a long-term anxiety disorder, she agreed to come into the office, and then at the last minute, literally 20 minutes before, said, I can't come in because I'm afraid to go in the elevator.
Oh.
Someone might have touched the wall on the elevator and I'll get this virus. So it's interesting how the fear manifests, and the understanding and lack of understanding of disease, and how it's spread. So I think that there are varieties of levels of understanding, and that affects anxiety, and that affects our therapeutic relation with people, whether we're in the medical field or in the psychiatric field. And so that it's not fair to put so much responsibility on the virologists finding a vaccine. But I think that once a vaccine is found and used and is out there for everyone, that a lot of the anxiety will dissipate.
Yes.
But I do believe that some of this behavior, some of these concerns will linger for a long time.
Yeah.
And, there's some positive things too that will be an outcome of the changes that we've had to make in how we live our lives.
Yeah.
And I think that we've become a little bit more understanding of how just a few months of change can improve the environment, and how overused some of the advances that we have, like our automobiles and our airplanes, and we've overused them. And I think business is looking at changing how they run their companies, that they can run a company virtually rather than pay hundreds of thousands of dollars every month to transport their employees to major conference centers, and then all the money that's involved with that. So I think that getting through this really very, very difficult time, and companies still being able to be productive, those are going to be some of the long-term changes. And people are going to have to adjust to that. And that might be anxiety producing, because getting through a crisis is very different than establishing brand new behaviors long-term. So there's a different kind of adjustment that human beings go through from a psychological perspective during a crisis, and during what, for lack of a better word, we'll call the regular time.
And you touched upon an important issue, which I think is the infrastructure of the places where we treat patients. And I think, you see also so many changes already around us, the way post offices or library work in, outside pickups, or you have to do everything electronically. As you know, our waiting rooms and our offices even are very unprepared for physical distancing, as there is this switch now not to call it anymore social distancing, only physical distancing, because I think it has negative connotation to be socially separated versus physically. But how do you feel it changed in the way you are comforting patients? Because as you said, part of it is nonverbal communication, but I know that, remember when we used to meet, we hugged, and we were giving kisses, whether it's an air kiss, and that markedly changed. Do you see that also in your office?
I do. I mean, certainly there's a professional distance that in psychiatry, we don't touch our patients, we don't hug our patients, we don't kiss our patients. And so that, of course, needs to be maintained, but I do see it in how people arrive and leave. Many of my patients would come and bring someone with them to feel safe and to come into a hospital environment. They have a companion with them, so that not having that person with them has affected how they arrive. And sometimes the first 10 or 15 minutes of a session that they're in the office with me is really about just settling down, having gotten themselves there by themselves. And that's a lot more people than you think. And part of why our waiting rooms are so full is because at least probably 1/3, 1/4 to 1/3 of the seats are taken up by companions, whether it's at your office or my office. So that, I think, is different for people. And I don't know about your actual environment for your outpatient practice, but at our site, we had to take half of the chairs out of the room, and they just literally were taken out and put away in storage. So that, I think, has made it a little bit easier for the people who come, because they sit where they sit and the decision has already been made for them. And I hopefully that will become the norm for them. But you know, I think it's true just in general. We work in an academic environment, as you know, and we're looking at many of the trainees leaving and new ones coming in. And just yesterday, I went and found our pulmonary fellow who has been with us for 5 years. And I went to say goodbye to him and wish him luck. He's moving to Texas. And so he said, "I'd like to hug you, but I don't think I can." You know, so it's this constant awareness of the differences that we are facing as we move forward in our society. And that certainly affects everyone. So,
and you know, Ellie, when I was referring to hugging, it's more, you know, when I was meeting with you and some other colleagues, you know, I'm talking
exactly
professional, that, you know, we were meeting in a hallway. It's very different. You know, the first thing yesterday, I was walking next to our gastroenterologist, and, you know, he wanted to high five, and I high elbowed him, you know, and all of this is really changing how we respond to people and with the distancing. And, you know, you touched upon the trainees, and I want to talk about that, because, you know, I always see you so close with your students. You teach them when they come up on your rotation. And, you know, that's another thing that we need to recognize here, that you have been a tremendous teacher, and you have connections with university, and you have this stream of young people who should be learning about mental health disorders. And I just wonder, what are your thoughts about how that is going to change for you or for them?
Well, I hope it won't change too much, because they still need to learn about it. We'll see. I'll have a more definitive answer for you after July 6th, because as you know, the medical students have not been with us since the beginning of the pandemic. And they're scheduled to return to the system on July 6th. So we'll see. And they are actually on site 40 hours a week. So we'll see. I'm hoping that it will be the same for them, because they certainly need to learn some of the skills that they need to learn are real basic diagnostic skills and interview skills, and learning how to do a psychiatric interview, and learning how to sit with people and not take their blood pressure and not listen to their heart, and or not, you know, examine their feet or whatever part of their body they would like to. And it can be difficult for a lot of trainees, whether they're physicians in training or nurses or physical therapists or whatever. So it's a challenging rotation, I think, in general for them. But the skills that they learn, I think, will help them as we move forward in many of their other subspecialties. So we'll see. I'm hoping that it won't change too much.
Yes, so you're
Right,
right that we are learning on the go. There's nobody really told us how to do it, whether with residents who are
right,
coming a little bit earlier or fellows. How do
right,
we do it safely and wisely? But at the same time, I think we have an obligation to teach people, and I think it would
right.
be a disaster not to have the students because
Oh, yeah,
nobody said that this pandemic is going to go away with a vaccine. We have no idea
right,
how
right.
active or how effective the vaccine will be. And,
Mm,
obviously we don't want that, but what if it stays with us for 5 years? We need to teach students and residents. We can't just take 5, 6 years break in educating future healthcare professionals.
right. I mean, I think the only one major frame of reference I have in my professional life is earlier in my profession, I worked in medicine before I went into psychiatry, and I was involved in um, being the nurse in charge of the first HIV unit here in Rhode Island. And I remember the frightening feeling of not knowing what we were dealing with, and young people dying. And certainly I look at HIV and I understand HIV is a very different thing. And initially everyone thought that, of course, the only people that got HIV were young gay men. And of course, we learned very quickly that that wasn't true.
Yeah.
But in some sense, it didn't completely short circuit our society, but it certainly had a profound effect on medicine and providing care, and very much providing mental health care for
Yeah.
this population. And once we realized that the HIV was also spread in the IV drug abuse population, and also through the sex trade population, it expanded the population of people that were exposed to HIV. And it took years, I think, for all of us to kind of
Yeah.
find our way therapeutically through that crisis, and before the scientists really started getting very reliable treatments
Yeah.
for people with HIV. So, and I remember the level of fear that the young nurses had, and the young physicians, of just going into the rooms, and how were they, and we didn't have the personal protective equipment then that we have now even.
Right.
So we didn't even talk about it.
Mhm.
Personal protective equipment. There was not any vocabulary for that. It took a long time for everyone to settle down. I
Yeah.
think that society in general didn't experience that, because most of the people felt that they were immune because they weren't a gay man, or they weren't an IV drug abuser, or they weren't a prostitute.
Yeah.
They sort of isolated the people with HIV and separated them out from society. But I think it was a much larger group of people than we really think.
Yeah.
And there's a lot of parallel for the healthcare community, and
Yes.
how the lessons of that time needed to be learned and understood.
Mhm.
Very similar, I think, to what's going on now for healthcare providers.
Yes, I did see a lot of references to early HIV days, and even I believe Dr. Fauci, who
Mm.
is now the
He
most,
was there then.
he was there then as well, and
Yep.
so he's
He
dealing.
had black hair though.
Yes, yes, very different in a sense as well.
Yes.
Um, but it also shows, when you think about the gray hair, it also means wisdom and experience and
Absolutely.
perspective. So
Oh,
that, I
absolutely,
think those are
absolutely.
all good things for
Oh,
people who, stand
yes.
there majority of the time.
Mm.
I wish there was a little bit more women talking in this time of pandemic. You sometimes see them as a, being like next to, let's say, governor, or there's a few
Mm.
women
Mm.
governors and mayors, and it's very good and refreshing to see. But I think that women messages are sometimes different, possibly warmer.
Oh, sure.
And uh,
Absolutely.
sometimes I think I'm missing that part of
I
women
agree with
collective
you.
wisdom.
Yeah, I agree with you, because I think that there are a lot, especially in the infectious disease world, there are a lot of women who are physicians and who specialize in infectious disease. And unfortunately, you know how people are, they want to hear from the experts in charge.
Yeah.
And for the most part in medicine today, the majority of experts in charge still seem to be men. That's changing, and that's good. I mean, I did see one report about a woman, apologize for not remembering her name, but she's a virologist, and she's an American, but she works in Australia. And she, early on in the pandemic, there were a few interviews with her, and there was a thought that the vaccine would come out of her lab because she was identified worldwide as the expert in viruses.
Yeah.
And
Remember
so
that.
there are a lot of women, but of course she doesn't stand in front of a microphone
Right.
and share her wisdom. So I do understand what you're saying, and I do agree with you that women, just as women, present situation and information differently than men do.
Yeah.
And that's a good thing. I think
Yes.
that's a wonderful thing, that there's the differences between the two sexes. And I hope that that never changes.
Right.
Because I do believe women bring a special thing to medicine and to psychiatry also.
Absolutely.
And that's not to say that men's contribution is not good.
One of the things that I wanted to talk to you about some tips, Drew. What is your few simple recommendations as a psychiatry professional for medical professional, but also for your patients? How do you relax in this large time of uncertainty?
Well, I think probably some of the simple things which we forget about are the most important. Making sure you get enough rest. And each person, adult, should probably understand about how much sleep they need. The sleep specialists say an adult human being needs between 6 and 8 hours of sleep in 24 hours. So each person needs to figure out what's their best sleep ratio. So get good sleep, good, healthy, restorative sleep. And maintain a good diet, of course. Make sure that you have the right nutrition. And I know that's been difficult for a lot of people during this because of loss of jobs. And it's been, it's been a profound issue for many millions of people. And I'm very respectful of that. And as we move forward and as people start getting back to work and hopefully their lives settle out a little bit financially, I think paying attention to diet and basic activity and basic exercise to the person's individual ability, and finding things that are restorative, whether it's being with children. I mean, there's been multiple studies that the people that get the most hugs in the day are the happiest people in the world. And who gives the most hugs? Children.
Yeah.
So if you have children in your life, allow them to help you. And give you that back, unconditional hugging and loving and joy. And then I think, and this is probably the hardest, is to try and find something that allows you to escape. Now, I know you and I have talked over the years about things that make us happy.
Yeah.
I've been very, very fortunate that when I was very young, I found photography. I was given my first camera when I was 14 years old, and it has been a mainstay in my life. I've traveled all over the world, and my camera has always been with me. And I have had my own darkroom in the past and, produced black and white photographs in my darkroom. But now I'm doing more digital stuff. So, but I've been very fortunate. We laugh about arts and crafts and stuff, but those are important things. If you find something that you really enjoy doing, whether it's woodworking or knitting or anything, it doesn't matter. Make sure that you allow yourself to have time to do that. And read. And of course, another passion in my life is reading. I love to read. There's nothing better for me, and I know a lot of other people too, is than to escape into a book. And television has such a variety today. There was a time when there were only 3 or 4 stations. Now we have 700 or 800 options.
Probably.
With the modern, these smart TVs and
and more on internet.
And the internet
even.
Absolutely. And I think there's a fine line between obsession with an alternative behavior and actually using it in a healthy way. No, I know we talk all the time about, especially teenagers who get lost in these computer games,
Yeah.
and that's always a danger, getting lost in any activity, but finding a balance. And I talk a lot with my patients, my outpatients in therapy, that it's really about finding balance and
Mm-hmm.
understanding what the balance is in your life. And that when you find yourself drifting off to one end of the continuum, that it's a time to take a few deep breaths and say, okay, how can I reestablish balance in my life?
Yeah.
And each person finds that in their own way. And there's no right or wrong way, as long as what you're doing is not self-destructive.
Yes.
No.
Hmm.
And
So you touched upon so many things here. You mentioned good sleep, which we know it is supported by science, but it's
mhm,
very important. But the sleep is interesting things that emerged during the pandemic about sleep, because people describe the most bizarre dreams.
mm,
And I can tell you that at the beginning, when we first had a state of emergency and we shut down, it was in March now, which is hard to believe that it's been quarter of
mm,
a year,
I know.
which is a long time.
It is a long time.
So my dream was, and it sounds bizarre because if I had this dream, let's say last October, I would be like, who cares? But what happened is I was running in a crowd and more people were coming at me from all directions. And this was truly a nightmare. I woke up and this is truly, I mean, as I said a while ago, it would be one of his things, but I think it was part of my processing of the
Mhm.
pandemic. And
Absolutely, absolutely. I had the great fortune of, after graduate school, I was able to do a 2-year program, a continued training for 2 full years after graduate school with a Jungian uh, group of clinicians. And Carl Jung did a lot of research on dreams, and subsequent to his work, many other people have looked at dreams and the importance of dreams in the human experience. And so I don't pretend in any way to be an expert, but I'm glad that I've had some education on it. And dreams are very, very important. And they do help us. We work through unresolved issues in our dreams in very symbolic ways. And and they're frightening sometimes. Sometimes they're very pleasurable. Sometimes they're very surprising. And probably what most of the dream experts say is one of the more important things to think about when you wake up from a dream is sometimes not necessarily the content of the dream, but what's the feeling that you wake up with? Are you sad? Are you happy? Are you surprised? Are you angry? And that's something to pay attention to, is the feeling that you get. And yes, people have been having strange dreams and unexpected dreams that lots and lots of people have shared with me during this time. And but I see that as good. I see it as all good. And because we really do not have the time sometimes during the day to sit down and really work through what's bothering us. And if we weren't dreaming about those things, I'd be more worried about people.
yes.
That if we weren't dealing with them in our dreams. And
Yeah.
there've been studies where college kids volunteered for these dream studies, and they hooked them up with electroencephalogram machines at night while they let them sleep. And every time they started to dream, they woke them up. After 2 weeks of these very healthy, none of them met criteria for any psychiatric illnesses. None of them had any physical illnesses. And after 2 weeks of not allowing them to dream, I think something like 26 or 27, in one study that I remember in particular, 26 or 27% of the participants were psychotic after
Wow.
not being allowed to dream for 2 weeks.
This is scary. This is a very scary
But
number.
I think it was eye-opening, and
Yes.
it led to many, many other research studies on dreams
Right.
and the health of dreams.
Right.
And
Mm-hmm.
so, so there, no matter what the content of a dream is, it's important.
Yeah, let it just let it
Yeah,
play out, and you wake
right,
up, and it's good to sit down and think about it. And as you said, the power of meditation, nutrition, and
right.
also hugging. I'm sure that you are aware of. There is a big following right now. People, obviously you cannot hug the bird, but there's this huge comeback to nature and
Mhm.
contact with nature, and birding took off unexpectedly, and people watch birds. But another thing is people talk about the how much they appreciate. We appreciate pets and animals, but having pet to hug, the cat, the
Right,
dog,
right.
there's so much of that also. So it's not
Yep.
only appreciation of human contact, or is any source actually looking for these little things that really can make a
Contact.
big difference.
Absolutely, absolutely. We we're a species that needs to connect physically.
Yes, absolutely. Yes. And then, look even at the design of our towns. You have miles, but there is this consolidation of the houses, and we still
Right,
conglomerate together for goodness of it, and help and exchange of experiences and feelings,
right.
and in old times medicine. And so this is all where we are. And unfortunately, it brought us also some problems with it, that we too congested.
Mhm.
We stressed some of the nature, and people are talking about that as a beginning of truly a problem and a pandemic.
Right. Oh
And
yeah. I think again, we're a species that has incredible simple needs, and yet we're very complicated because we create a lot of our own problems
yeah,
by
for sure.
excess.
Right, for sure. Ellie, so you mentioned a book. Anything you're reading right now?
I'm into an author right now. I'm sure you've heard of him, David Baldacci,
Yes.
and I've been reading all of his books.
Hmm.
So
Okay.
so I kind of go by authors, and not always, but for some reason I've just been into all of his books. So that's what I'm doing right now. But to me, I'm pretty eclectic. Over the years, I've read fantasy, and
Yeah.
I read police drama, and I love my baseline real love of books is historical novels,
Hmm.
well written
Yeah.
historical novels, fun to get lost in someone else's story. So
Oh, that for sure. And the reading, for me, reading the larger books was very difficult at the beginning of a pandemic. I find myself a very short attention span
yeah,
and
yeah.
focus. So I concentrated on short stories, but
Mm.
now I'm back into the larger novel. And I also discovered the reading books on CDs, which I really like and strongly recommend. I really love it.
Oh, so audiobooks, you mean?
Audiobooks, uh-huh.
Mm.
Yep, on my, I drive pretty large distance to work. So this has been really great to cut
Oh,
myself off from
uh-huh.
news and completely switch gear. And it really takes the mind away. It's amazing.
Mm.
Ellie, so thank you again for this very useful and nice and eye-opening conversation. And I think, your expertise and years of your practice definitely show through every sentence that you shared with me. And I wouldn't mind if we did it again, probably maybe better times or different times.
Sure.
And maybe we can choose a topic and something that relates possibly to my field. And I'm thinking one of the things that we combine and probably understand a lot about is pain, and how pain can be sometimes the reflection of what's going on mentally with a patient.
Absolutely. I agree with you about that. And I'd look forward to that. That's good.
Okay. Awesome, Ellie. Thank you
Oh,
so much again.